So the fact that the user will talk to a device and will let the device know that she's just going away for a couple of hours and she will be back amazed us. And if you want to have kind of a real demo with the device, you can just scan the code or just visit leq.com and schedule a real demo with LEQ, or of course, order LEQ, one of LEQ device to your family members. Thank you all.
Please welcome the CEO of CaringBridge, Liwanag Ojala.
A few years ago, on what would have been the 20th anniversary of her daughter's birth, I went with my friend Joanne to the NICU. And it was where her baby girl was born, and she lived only 9 short days. And her baby's name was Bridget. She arrived at only 26 weeks, and it was June 1997, and she weighed only 1 pound. And at the hospital, we met a nurse named Kathy. She happened to be on duty as a nurse all those years ago when Bridget was a patient. And together we relived the moments when tiny Bridget was struggling for her life. And then Joanne got to gently put her hand in a porthole of an incubator that was just like the one that baby Bridget was in. And I will never forget this image. And she patted the place where her own baby, in a little pink hat, had been connected to so many machines. And watching Joanne with so many emotions, I felt my heart might burst for her. And you know that feeling when you've been part of something that is so powerful, almost sacred? Well, that's what it felt like for me on that day. And we left the NICU, we were in the elevator down to the lobby, and Joanne shared with me how losing Bridget had brought her and her husband Darren closer together. And that so early in their marriage, they knew that losing their daughter meant that they would overcome any obstacle that would come their way. And then Joanne said something to me that is the very essence of why I am standing on this stage right now. She said, "A lot of healing happened with my group of family and friends. They have taken this journey with us. Through their support, we found a path toward healing." And there it is, that very simple idea, but very powerful. Healing is possible and valuable regardless of health outcome. I am honored to represent CaringBridge. We are a global nonprofit social network, and we're there to support and rally that support for patients and caregivers on a health journey. And CaringBridge launched on June 7th, 1997, and that was the day that Joanne's daughter, Bridget, was born. And CaringBridge began as a single website our founder referred to as Caring for Bridget. And it came about because Joanne and Darren asked their college friend, Sana Mering, to let everyone know what was going on. And after making 2 phone calls, which were very hard, and you have to remember this was 1997, it was before Facebook, LinkedIn, any other social network that you're using today. Sana, who was a software engineer, she said there's got to be a better way. And she created that better way when she created CaringBridge. And of course, CaringBridge is baby Bridget's legacy. And I see Sana in the audience. Thank you for creating CaringBridge, Sana Mering. So fast forward through 22 years, hundreds of thousands of sites started by patients and caregivers. And because of the generosity of our donors, over 2.2 billion people have visited a CaringBridge site since 1997. From people in all states in our country and from every country around the world. And the way that Joanne talks about healing is something so familiar at CaringBridge, because today, 300,000 people and by the way, every day, will come to a CaringBridge site because of injury, illness, diagnosis, chronic conditions like depression, dementia, and we witness like no one else the power that can come from meaningful connection. And that's the essence of CaringBridge, a place of connection, a place of community that powers healing. And what we've observed millions of times over 22 years is that when people are surrounded by love and hope and compassion, healing is possible even if cure is not. And there it is, that idea again. So to honor these health journeys and to tap into the collective wisdom of people who have experienced very, very tough things in their lives, we began 3 years ago asking CaringBridge users to share their stories with us. And working with our friend, David McLean, David is a National Geographic photographer, we have so far met with 35 families who represent the nearly 800,000 CaringBridge users who have started a site. And every patient and caregiver we met, we asked them to describe what healing looks like for them. And we asked them 3 questions. First, how do they define healing? And secondly, what specific things have helped them heal? If they've been able to find healing, and sometimes they haven't, which we'll talk about in a minute. What keeps them going, no matter what, and are there any universal truths that we can share with others that we can learn? Now, scientists will tell you that there is no certified or universal definition of healing. But everyone we spoke to said something like this: healing is being able to move ahead with what remains. Healing is trying to make yourself whole again. And so that has become our working definition of healing. And we also observed that when healing happens, it really looks different for everyone. This is a picture of Juan Martinez. Juan is a firefighter from Uvalde, Texas, and he's here with his father and his son, Jackson. And when Jackson was 2, he had neuroblastoma. And they're a wonderful family. They have a deep faith. And Juan and Judy, his wife, shared with me that they turned to doctors for medical care, but they turned to God for healing. So for them, being able to believe has been the path to healing. After their baby was diagnosed at 4 months with cancer in both eyes, Doug and Leanne O'Donnell of Houston, Texas, opened their hearts to the love and support of family and friends. Leanne said to me, "So many people have come alongside us. They have carried the burden of life so that we can focus on our son. They have helped us heal." And what a testament to the power of meaningful connection that can come from belonging to a community of family and friends. And we were also so honored to meet Jeff Edwards in this work. Jeff is from Herman, Minnesota. He's a member of the Army's 82nd Airborne. He was a deputy sheriff. He went on to become a SWAT team marksman, and he's a true warrior. And then one day he was on a beach vacation and he got hit by a rogue wave and he broke his back. So his life was upended. It really changed the trajectory of what he had planned. And while he was being cared for at the VA, he said this accident simply could not be the defining experience of his life. For him to be, he had to make sense of something that made no sense. So today he works full-time. He is an advocate for the Paralyzed Veterans for America, and he's also a supporter of CaringBridge in showing people with similar injuries that healing can come from something catastrophic, and that healing really is possible. So I want to thank and celebrate these families for sharing their stories with us. Part of our mission at CaringBridge is sharing these stories and findings with the hope that first, it will help somebody with a similar injury. But second, that our healthcare system can better understand and even integrate these tools into their practices. Now, what emerged from this work were three crystal clear universal themes. And the first element is what we call believe. Faith and spirituality, just like the Martinez family turning to God. And what we discovered is it doesn't have to be God. It can be meditation, nature, music, art, just something that you can believe in when you're on that health journey. And next is the theme that we're calling belong. Family and friends, like the O'Donnell family, who felt that sorrow shared is cut in half, but joy shared is doubled. People need each other. They need to be part of a group. You need each other for the highs and the lows of life. And then there's B, which is about meaning making, like Jeff Edwards. He said that even if he can't be 100% of what he used to be, he wants to be 100% of what he can be right now. Others choose to create meaning by sharing their experience, advocating for others who have similar conditions, not just conditions, but sometimes in loss as well. So these three themes started evolving into a framework and something to start a conversation so that people can find themselves in this on their path to wholeness. So imagine if patients and caregivers can look at this and say, where am I in the framework? They could see, is it believe, is it belong, is it be, or some combination? What can they do to help themselves? And we kept looking at this like a prism or a Rubik's Cube, and we realized we were onto something. Because in our multi-trillion-dollar healthcare system, a simple framework like this does not exist. Why? Why not? Well, we traditionally think of healing as something clinicians do with medical interventions and trying to cure disease. For example, when was the last time your doctor or nurse asked you, what can you do to help yourself heal? So there's a vacuum around focusing on the power of patients and caregivers, the power they already have in them and what they can do in their healthcare. So imagine if the healthcare system adopted a framework for healing, integrated it with clinical practices. Now we know that people can't control their health outcomes all the time, but we don't always think of people being able to conjure their own power on their path to healing. So for this to actually be a framework that has mainstream application, and we want this for patients, family caregivers, clinicians, other healthcare professionals as well, you need science. And we are not scientists at CaringBridge, but we're very, very fortunate to collaborate with many people who are. And many of them have actually used CaringBridge as patients and caregivers themselves. So the ultimate goal of this work is to help educate and inspire people to find a path toward healing for themselves using measurement and having the scientists help us to make sense of what's being articulated to us. And I want to share with you a few of the highlights from the research that's underway. We're working with the University of Minnesota, analyzing more than 50 million anonymous journal posts, 50 million over our history. And so far, we are seeing the benefits of things like gratitude practices, loving kindness practices, and the importance of emotional, spiritual, and instrumental support. We're also working with researchers at Mayo Clinic to study stress reduction associated with expressing your thoughts during a health journey, and with the nonprofit Health Story Collaborative, based in Boston, on the benefits of sharing your health story. So 3 years ago, when we started this project of trying to explore what healing really means, we started thinking that healing was a choice over which you had control. And as we're always open to learning at CaringBridge, what we discovered was that the possibility of healing is sometimes a very, very long journey. And we saw this in the fieldwork too, and I want to share a story with you. This is Tracy Lopez. Tracy is a mom from San Antonio, Texas, and her daughter was struck by a drunk driver 10 years ago in her own front yard. And this is Ava, Tracy's daughter. She still lives with the effects of a traumatic brain injury. And if, as you might imagine, Tracy has had to face some very, very difficult emotions. In our developing framework, she would tell you that she does belong. She has a great group of family and friends. She established a nonprofit to help other families with children who have a brain injury. And she's trying to make sense out of the whole experience. She's trying to let it be so that she can become whole. But after 10 years, she hasn't found healing yet. She's trying. And in the end, that's all any of us can do, is we can try. I want to share with you a short video that encapsulates our notion that healing is possible.
For almost 25 years, I've been teaching and doing research on all aspects of health, healing, and well-being. So one of the things that I've learned is that healing is possible.
When he was 2 days old, we got a diagnosis that he was missing his tibia bone, and they said the only treatment for that would be amputation. We didn't know if he was going to be able to run and jump and, do normal things. So 5 years into our journey, climbs everything.